If you're watching this, there's a good chance you've had a facelift and you're not happy with it. Maybe your scars feel obvious. Maybe you look tight or overpulled. Maybe the result just doesn't feel like you. Let me start by saying this clearly. You're not alone and you're not being too picky. Revision facelifts are a real part of what I do every week in my San Francisco and Beverly Hills practices, and there are solutions. But there are also limits, and timing and technique matter a lot. In the next few minutes, I'm going to talk to you about several essential truths about revision facelift surgery in the San Francisco Bay Area. This isn't sales, and this is not hype. It's just the realities I want every patient to understand before committing to a second operation. This is truth number one. Revision facelifts are usually more complex than the first one. A revision facelift is not typically just doing the same thing again. Your face has already been operated on. That means scar tissue under the skin, slightly altered or damaged blood supply, and tissues that might not move the way they did the first time. So, revision surgery takes more planning, more finesse, and a more realistic conversation about what can be safely improved. Truth number two, deep plane versus smash matters more in your revision. You're going to hear buzzwords like smash facelift and deep plane facelift and so on. Well, here's a simple version. The smash works more on top of the facial support layer. The deep plane goes under the smash, and it releases deeper ligaments and lifts the face in a more holistic connected unit. In revision cases, the deeper layer is often less disturbed than the surface. So a deep plane style approach can sometimes fix a tight or pulled back look without just yanking skin again. Truth number three, timing is everything. Most people need to wait before deciding on a major revision. Early after facelift, the face is going to be swollen, firm, and a little uneven. This can look scary, but it can also be normal healing. In general, I want to reassess you around 6 to 12 months after your first surgery. That's when scars and shape have sort of declared themselves. Truth number four, if your scars are under 12 months old, you may not need surgery. Scars definitely mature over about a year. So if your scars are a little red, thick, uneven, but it's still well under 12 months, we have many non-surgical options for you. There's injections, medical grade skincare, exosomes, microneedling, lasers, and other things which can improve color and texture dramatically. They won't necessarily move the scar, but they can make it blend. Truth number five, scars that are over a year old and still obvious, well, surgery may be the only realistic fix. After about 12 months, scars are fully mature. If an incision is a little wide, red, thickened, or poorly placed, no amount of laser can actually shrink it back into a fine line that we all want. This is where surgical scar revision comes into play. We remove the old scar tissue and reclose it with better tension and placement. This way it's usually more hidden and more in line with the nice curves and creases of your face. Truth number six is, some common facelift problems are actually quite fixable. Two things I see a lot in revision consultations. One is a pixie ear deformity, where the earlobe looks sort of pulled down and attached to the face. The other is contour irregularities, such as dents, ridges, tethering along the cheek or by the jawline. These can often be improved by releasing old tension, repositioning deeper tissues, and maybe even redesigning the closure. This isn't going to be perfection, but it will be a meaningful reset towards more natural. Truth number seven, revision is emotional and it is not just surgical. A disappointing facelift can really sting. You may feel embarrassed, angry, and afraid to trust another surgeon. That's totally normal. In my consults, we do talk about anatomy, but we talk about more than that. We talk about what you hope for, what feels unacceptable, and what a safe improvement actually can look like. Truth number eight, not every problem needs another facelift. Sometimes the right solution is not a second facelift. It might be a scar treatment only. Maybe it's fat grafting or fillers to replace volume. It may just be something that's focused on the neck. My job is to match the fix to the real problem, not just repeat a procedure. Truth number nine, start with a clear, honest plan. If you're considering a revision facelift in San Francisco or anywhere in the Bay Area, your first step is a focused consult. We're going to review what was done, what bothers you now, how old your scars are, and what can realistically improve. Revision surgery is often more expensive than a primary facelift because it's a little more complex and takes longer. But you should leave a consult with me with something priceless, clarity. If your facelift result doesn't feel quite right, you're not stuck. There are often real steps we can take to help you look more like yourself again. If you have questions, please drop them in the comments below. I do read them. And if you want to take a deep dive into these types of revisions, please fire away and let me know. If you enjoyed this video, you may find this other video useful. Of course, if you'd like a consultation, please contact my office and we'll set one up. As always, thanks so much for watching.